Good morning, everyone. It's surgery day. Today's the day of my first surgery. So I got up at 6. 6 a.m. is when I usually take my morning hydrocortisone. So today I took 60 milligrams of hydrocortisone along with my pantoprazole and minocycline. And I also took a Pepsid. And they said I could have clear liquids until about 2 hours before I need to be at the hospital. I need to be there at 11. But I'm going easy on that because of the reflux. But I did make myself some ginger tea. So that's what I had this morning. And that's about it. That's my morning. So today is surgery day. I am staying overnight because of the adrenal insufficiency. They're going to keep me for observation for one night. So good morning. I just wanted to add, look at this little dog. She's just laying across my lap. Good morning. It's the morning after surgery. My throat's a little scratchy because I was intubated. They did do the partial mastectomy of the left breast. They were able to save the nipple, so I'll have a nipple. And then with the lymph nodes, they took the 3 lymph nodes and checked them, and there was some cancer cells present, so they took the rest of the lymph tissue. So a lot of my recovery and the more invasiveness of the surgery has to do with the lymph tissue all being removed from that armpit area. I've got some ice packs here. Can't really show you much else. I have a nice view of the east sky. Oh, I can't switch that. So I got to see the sunrise. They were in at 6 o'clock with my 6 o'clock meds. And I just met the morning nurse. So, and I know I have breakfast ordered, so I don't know when that will be here. But it's about 7:30 now, so breakfast, the kitchen opens at 7, so I don't expect it for a little while yet. And I probably will go home today. They said I have to be cleared by PT. So I already saw a doctor today who came in about 6 o'clock and said that they would be sending PT over to evaluate me. So that's about it. Hey everyone, I'm home from the hospital and just waiting for my dinner. My husband's out grabbing some dinner. My throat is a little scratchy from being intubated, so my voice is like really deep today. And my cheeks are rosy, possibly from some of the medication that I got. So that's my update for tonight. I'm probably gonna just edit all these together and do one interview when I'm a little more with it and can, kind of have some closing thoughts about the whole surgical experience. But I'm home. Hi everyone. So it's a couple days after surgery. I'm sitting in my rocking chair recliner. That's kind of my bed and comfort zone. So just to recap, surgery, I did have a partial mastectomy of my left breast. The cancer surgeon took all of the area where the tumors were out of my breast. And then she actually took 4 sentinel lymph nodes out, and they brought those to pathology, while the plastic surgeon finished up closing up the breast and reconstructing it. So it was the lumpectomy or partial mastectomy with the reconstruction of that breast all at the same time. 2 out of the 4 lymph nodes were positive for cancer. So the cancer surgeon came back in and took all of the lymph tissue. They don't go searching each individual lymph node. They just take all of the lymph nodes and all of the lymph tissue out, and all of that will go to pathology. So we'll get a report in about a week, she said, to find out the results of that. And those results will dictate if there are more treatments recommended as far as chemo or a pill. Usually it would be a chemo pill. I will be getting radiation either way. So that's the next step. I have a follow-up appointment with the plastic surgeon in 1 week, and then the surgical oncologist, the breast surgeon, cancer surgeon the following week, along with my medical oncologist. So we'll be discussing, I have 3 appointments basically within 2 weeks' time, and we'll be discussing all of that. From the adrenal insufficiency side of things, what we did is I did a triple dose the morning of surgery of hydrocortisone. So it was 60 milligrams because I had been on 20 in the morning at 6 a.m. So I did 60 milligrams of hydrocortisone the morning of surgery, orally. I was allowed to take that with water. And my surgery wasn't until like the afternoon. So I had to be there at 11 for them to they put in a wire guide into the lymph node where the biopsy clip was, before the surgery happened. And then went in for surgery. The surgery was about 3, I think my husband said 3 or 3.5 hours. He got text updates. And then was in recovery, stayed overnight in the hospital, and they discharged me about 10 or 11 o'clock the next morning. I was discharged to come home. Sorry about that. So my aftercare now, I'm just obviously have a pretty regimented protocol for medications. So as far as the adrenal insufficiency, after in the hospital, I had 100 milligrams of Solu-Cortef IV during the surgery upon induction with anesthesia. And then while I was there, I had 50 milligrams IV every 8 hours. So I think I had 2 doses of that because I wasn't there for 24 hours, and came home that evening. I took, I think I took 50 milligrams orally once we got home that day. So in that 2 o'clock in the afternoon, yeah, that's what we did. 2 o'clock in the afternoon, where I normally would take a lower dose, I took the 50 because that was the third 50 milligram dose. So that was a full day of 50 milligrams every 8 hours. And the following day, what the endocrinologist did is we switched to dexamethasone because you can take a smaller amount, and it's like the higher amount of hydrocortisone. So instead of taking, tripling my dose, she wanted me to triple my dose for at least 3 to 5 days, and tripling my dose of hydrocortisone would be 60 milligrams in the morning, but I could take 2 milligrams of dexamethasone, and that's the same thing. So that's what we're doing now, for at least yesterday and today. 2 milligrams of dexamethasone 6 a.m. and 1 milligram of dexamethasone at 2 p.m. That seemed to work well yesterday. I'm on pain management, alternating between Tylenol and whatever pain narcotic they gave me. Don't need to take it every 4 hours like it's prescribed, but so stretching it out a little bit and alternating with Tylenol, and then also using a lot of ice. Ice helps tremendously with the pain. So I kind of sleep with ice packs on me, and that all works well. And then we have to clean the drain twice a day. So I don't know, it's YouTube. I don't know if I'll do a video on cleaning the drain. We might. Usually I have help, so 4 hands are better than 2. We have to basically bleed the line into this little pouch that it collects in. There's a little light suction, gentle vacuum. It's constant kind of vacuum pressure on the line, draining from the lymph area. And so we just kind of bleed that line into the little pouch, open it up, and we dump it into a cup, like a measuring cup. squeeze it and close it again so it stays compressed. That's that gentle vacuum to continue draining. And yeah, so we just empty that twice a day. The liquid looks healthy and clear-ish, you know, reddish clear, pinkish clear. It hasn't started to change color. We get about, I think 20 milliliters of liquid each time, and we clean it out twice a day, and that's normal. So that will probably be in about a week. So when I go to the surgeon on Wednesday, and they said a week or two, so she'll check it on Wednesday. If they don't take it out on Wednesday, I can go anytime. If it stops producing, or I think if we go under 20 milliliters a day, the discharge instructions say that's when it's ready to come out, and I can just call and come down and they'll take it out. I can shower later today, so that'll be fun. But that's pretty much it. That's where I'm at right now. Doing my exercises. I might take a video of that too. Let's see if I can hold this phone out enough. I'll show you the exercise. So I gotta get in the doorway. And so there's the doorway here. So if you can see, I kind of put my hand against the wall, and then I walk my fingers up a little bit at a time. And so it stretches out the armpit there. And so that's about where I'm at right now. And I just hold it for 20 seconds or 30 seconds. I might creep up. That's about it. I'm not going to go higher than that because I can feel the tension down in the armpit. So that's the exercise. That's the one exercise they have me do. And the other is squeezing a stress ball. So that's what physical therapy sent me home on. And so that is the kind of recovery for breast reconstruction, partial mastectomy, and the lymph node dissection. And that's it. And we have my sleeping dog. She's sleeping in her dog bed. She can't get up in the chair with me, which she is very upset about. Would like to protest to anyone who will listen that she doesn't understand why she can't just get up on my lap right now, but she stays close by and keeps an eye on me. So that's about it. That's my update. 3 days post-op, first surgery.